This is the upper gastrointestinal bleeding tutorial presented by the SchrDbb with reference to practical guide to issue taking and clinical examination by Anwar Qais Saadoon. Upper gastrointestinal bleeding. So upper gastrointestinal bleeding may present as hematemesis or melena. So when you have upper gastrointestinal bleeding, you can vomit out blood or you have blood in your feces. Hematemesis is vomiting of blood which may originate in the esophagus. So when you have hematemesis, it is vomiting blood, and that blood must originate from the esophagus, the stomach, the duodenum, proximal ligament of Treitz. So proximal to ligament of Treitz, that's upper GI bleeding. It may be fresh, bright red blood or coffee ground emesis, depending on the duration of the blood exposure to the gastric mucosa. Now, there's a difference between hematemesis and hemoptysis. Hemoptysis is coughing out blood, and when you cough out blood, the blood must come from the upper airway. Are you getting? So that's coughing out blood coming from the lower airway. So lower respiratory tract. So because if you have epistaxis, you may still have hemoptysis when you cough. Are you getting? So the difference between hemoptysis and epistaxis is that epistaxis is just bleeding from the nasal mucosa. That's epistaxis. But you can have a form of hemoptysis if you have epistaxis. So hemoptysis is defined as coughing out blood coming from lower respiratory tract. That is full definition. So hematemesis, your food is defined. Melena is defined as a black, shiny, sticky, foul-smelling stool of tarry consistency, usually resulting from upper gastrointestinal bleeding above the distal ileum. Now, you have hematemesis. We continue. The history of hematemesis. You have identification, chief complaint, the history of presenting illness. You have duration, frequency of hematemesis, characteristic of vomitus. Vomitus can be coffee ground material, bright red blood, amount of blood in vomitus drop. You have 1 teaspoonful, 1 tablespoonful. You have forceful retching prior to vomiting blood. You have Mallory wasted. So if you have a forceful retching prior to vomiting of blood, is a Mallory wasted. So prior to vomiting of blood is Mallory wasted. We have recent stress. So recent stress can suspect. You can suspect also peptic ulcer disease, and that stress is not only the stress to your social environment. It's also a stress due to any trauma, a stress due to burns, a stress due to anything that can result to excessive corticosteroid secretion in the body, an accident and all that. So you have or a stress even due to an infection can result to a peptic ulcer or gastritis. So toxic. So you have toxic injection. You have associated symptoms. You have melena. You have fresh bleeding perirectum. Fresh bleeding perirectum is usually not associated with upper gastrointestinal bleeding, except there is a torrential upper gastrointestinal bleeding before you can have a fresh bleeding perirectum. So we have abdominal pain suggests gastritis. Abdominal pain suggests gastritis, peptic ulcer, esophagitis. If you have abdominal pain, gastritis, peptic ulcer, esophagitis. Bruising, you have nosebleeds, weight loss, anorexia and all that. So now, past history, prematurity, nasogastric suctioning. You have difficult delivery. So if you have difficult delivery, you can have a stress ulcer. Are you getting? You have bleeding during delivery. You can have a stress ulcer. You have lack of vitamin K prophylaxis. It can result to a coagulopathy. You have history of umbilical vein catheterization or infection. It can result also to a stress ulcer. Are you getting? So we have past medical and surgical history, prior bleeding episode, a recent history of epistaxis, bleeding disorder, peptic ulcer, gastroesophageal reflux, diabetes, renal failure, liver disease, jaundice, hepatitis, foreign body injection, nasogastric or gastrotomy, but gastrotomy tube placement, blood transfusion, gastrointestinal surgery. You can also make a passage of all that, gastrotomy, tube placement, all that can result to bleeding upper GIT. We have feeding, type of feeding, cracked nipples. You can have from breastfeeding. It can be the blood from the mother, which is inside the child. It's not actually the child's blood. So what are the key points in upper GI bleeding? Coughing of bright red faulty blood associated with symptoms of respiratory tract is suggestive of hemolysis rather than hematemesis. Hematemesis may occur due to Mallory waist tear, when you have a severe retching due to a tear of the esophagus. That's Mallory waist tear. You have esophagitis. It can be due to inflammation of the esophagus, esophagitis. It can be due to esophageal varices, which are shared with a liver cirrhosis. It can be due to a peptic ulcer. It can be due to gastritis. It can be due to iron injection. It can be due to vascular malformation. It can be due to bleeding disorder. So now the next is injection of maternal blood from cracked nipple is common cause of hematemesis in breastfed neonate. Now we have prematurity and difficult delivery. Prematurity and difficult delivery increase the risk of gastric ulceration and erosion and may bleed. So that's stress. Those are stress ulcer. Hematemesis preceded by. That is why every time in patients you don't give proton pump inhibitor, but you easily give an H2 blocker. So in these children, so like cimetidine, every time for 3 days at least, you give an H2 blocker, which is given 15 milligram per kilogram every 8 hours, so 3 times daily. So it's given 24 milligram for the whole days. That's 8 milligram per kilogram, 4 times in 4 divided doses. That's going to be the cimetidine. Hematemesis preceded by prolonged forceful retching or vomiting in previously well child suggests Mallory waist syndrome. Hematemesis preceded by prolonged forceful retching or vomiting in previously well child suggests Mallory waist syndrome. If you have a forceful retching, prolonged vomiting, more than 3 episodes of vomiting with now that we have to think of Mallory waist syndrome, which occurs due to a tear of the lower esophagus or the stomach. Hematemesis can result from extraintestinal source, such as swallowing of blood originating from upper esophageal, that is post-tonsillectomy or adenoidectomy, or bleeding, or in case of epistaxis. Sometimes certain drugs, food coloring agents mimic blood. We have also NSAIDs that may result to peptic ulceration. The persistence of unrecognized esophageal foreign body may cause esophageal edema erosions, which may result in hematemesis. The next is lower gastrointestinal bleeding. So from here we have seen upper gastrointestinal bleeding, and then I say thanks to kind attention.